Dr. Lawrence Afrin, Weinstock and Molderings, they produced a paper in the International Journal of Infectious Diseases, and people can look this up, called the possible role of the mast cells, something like this, in hyperinflammation, and the role of hyperinflammation in acute COVID, something like that. And in that, it was very exciting to see that, because they'd come to the same conclusion that I had.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this week's episode, I spoke with medical doctor Tina Peers about mast cell activation, or MCAS for short, histamine intolerance, and how Dr. Peers believes that MCAS is prevalent in many conditions like fibromyalgia, IBS, eczema, psoriasis, arthritis, acute, and long COVID. This was a really fascinating conversation, and one that most people need to hear, especially those who suffered from COVID, and even more importantly, those who took the mRNA technology that we were all told would be the cure. As always, the episode does end on a positive note, giving many options for those who are suffering from any form of MCAS-related condition or mRNA vaccine injury. Tina Peers, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thank you very much for inviting me, Lee.
I can't tell you how excited I am to be having this discussion today. So, Tina, to kick things off, could you share with the audience, first of all, what motivated you to become a doctor, and also a little bit about your journey since you qualified in 1983 up to today, and in particular, what led you to become interested in mast cell activation syndrome?
Okay, well, I actually wanted to become a doctor from the age of 13. There was nobody in my family who was medical, but I was always fascinated by biology, especially the human body. I thought it was just such a miracle, and the more I learn about it, the more I think it's incredible. And so, yes, and I wanted to do something that wasn't sitting in an office, and I wanted to do something to help people. So it seemed to sort of combine all of my interests and my passions, really. So I went to Guy's Medical School when I was 18, and I qualified in 1983. So I've actually been qualified 40 years, which Amazing. Is quite extraordinary. Initially, I trained as a GP, and I did that for 7 years part-time while I had my 3 children. And then I became disillusioned with general practice, actually, because I felt like sometimes I was given 7 minutes a patient. And I was asked to do the impossible in 7 minutes. And you couldn't even talk to people properly and hear what their concerns were, or get to know them and know how to address things. And I felt like all I could do was write prescriptions, and I didn't like doing that, because I felt that was just wasn't sorting out the real cause of the problem. It was just it was just sort of covering over the symptoms, and but causing other symptoms with side effects from the drugs, etc., which really wasn't very satisfactory. So I gave that up in a heartbeat when I was asked if I would run the contraceptive services for East Surrey. And I had been doing contraception clinics at the same time, and they were a joy because there was no pressure and it was just fun, and the women were lovely, and they needed good information to help them, control their fertility, and that was great. And I really enjoyed that. So I set up the services for East Surrey, then Mid Surrey, and then the whole of Surrey. I was involved with all of that for 24 years. And at the same time, I started developing a small private practice in the mid-90s. And I used to do vasectomies. I was known as the vasectomy queen. I did over 3,000 of those. And I enjoyed doing some of the procedures, like, the implants and the coils and things like that. And anyway, so I had a really lovely career. It was a bit of a sort of portfolio career, and I became a key opinion leader in contraception working internationally, lecturing and teaching and things. And then they started to really change our services. It was taken over by a different trust, and the Surrey County Council took £2 million out of our budget, which was given to them without ring fencing it. And so they actually overnight destroyed the services that I'd spent 23 years building up. And the teenage pregnancy rate went right up, and it all just became horrible, absolutely toxic to work in. And I resigned. And then I concentrated on my women's health private practice, and I became a menopause specialist, initially working at Chelsea Westminster Hospital. And then when the pandemic came along, they closed that clinic. And so then I became exclusively private. But in 2016, my youngest daughter, who had been ill all her life, became really, really ill. And over a 4-week period, her health massively deteriorated. And it was so alarming, and I was so worried, and we couldn't find anybody to make a diagnosis or to help us. So I realized pretty quickly that it was down to me to sort it out, really. And that's when I realized that she had Mast Cell Activation Syndrome and Histamine Intolerance. Now, 9 years before, somebody had said to me, do you think Jessie could have histamine intolerance? But when I looked on the internet, there was nothing. So that would have been in 2007. And there was just nothing on the internet to give any clues about it. But when I looked in 2016, there was some information, enough information for me to recognize that that's probably what she did have. And then we started looking for somebody to help us, and we couldn't find anybody. So we saw 6 different consultants and doctors. 2 of them were professors who were supposed to be at the top of their game. One was a dermatologist. The other was an immunologist who was treating a lot of people with eczema. And they had no idea. They had never heard of histamine intolerance or mast cell activation. And in fact, the professor in immunology, he actually said to Jessie in the consultation, I think you might have a brain tumor. And how he came to that conclusion, God only knows, because she definitely did not have a brain tumor. Can you imagine? You know, she was, let's see, well, how old would she have been? She was 23, 24, and she was being told that. It just was unbelievable. And luckily, you know how parents you can indicate information through your eyes to your children. And I quickly looked at her, and actually what I said with my eyes was, he's a complete twat, don't listen to him. And she looked so hugely relieved from looking absolutely terrified. Anyway, so finally I did find a Professor Vic Kular in London who was amazing and is amazing. And he is a urogynecologist who's very interested in treating interstitial cystitis. And he recognized very early on in his work that all these women with interstitial cystitis had certain things in common. So a lot of them had hypermobility, they had IBS, they had chronic headaches, they had fibromyalgia, etc., etc. And he realized and learned all about MCAS at that point. So he was fantastically helpful to us, and enabled us to get Jessie much, much better. So then, of course, once you become interested in something and you learn about something, you can't unsee it, can you? You just, so I'd be sitting in my contraception clinic taking a history of a woman so that I could recommend the safe hormones or contraceptive methods for her. And she would tell me that she's got IBS and this, that, and the other. And I'd say, I think I know what you might have. And the patients would burst into tears because they had never had anybody, first of all, take an interest in all these weird symptoms that they had. And secondly, make a diagnosis. And then thirdly, tell them some management strategies that might help to improve their health and symptoms, and then they would come back and tell me how much better they were. So I was making this diagnosis in about 5 or 6 people a week. And then getting more and more confidence and experience in helping people manage the condition. And in fact, the other day I went to a Sainsbury's home base in Reigate, and this lady who was serving me at the till, she said, "Oh, are you Dr. Tina Pearce?" And I said, "Yes." And she said, "Oh, you helped me years ago." Oh, wow. She said it was 2016, and she teared up actually, and she said, it was amazing. She said, I was bedbound. I was bedridden because I was so ill. And then I came to see you and for contraception. And you said, "Oh, I think you've got this." And she said, "You transformed my life. You gave me my life back." She said, "Now, here I am working full time and blah, blah, blah." It was lovely. It was just so lovely. And that happens quite a lot, actually. So, so it made a big difference to people. And that encouraged me to keep looking and learning and doing this. And so then I just developed this interest in MCAS and this experience. I wouldn't call it expertise because I'm not sure what an expert is, and it's very difficult. Do you know
there is a definition of an expert?
Is it?
It's someone. It's someone who knows more and more about less and less until they know absolutely everything about nothing.
I like it. Well, I'm certainly not an expert.
Yeah. Good job.
But I'm gaining an experience with every single patient I see. And do you know what, Lee? The best thing is the patients teach me so much. Patients are amazing, and what is also amazing is that initially, until 2022, I would say, I sounded like a bit of a lone voice talking about MCAS, and GPs and doctors would just poo-poo it so often. And then, in 2021, along came long COVID, and I was one of the first doctors who said, "I think this is MCAS driven, and it's post-viral fatigue. It's, And in the MCAS patients, this is what happens. And COVID is particularly good at switching on the mast cells and irritating them. And then it became called long COVID. And so since then, the MCAS has been much more talked about and known about. And of course, once you put it out there, the patients are incredible at researching and learning and studying it. And they're telling their doctors about it. And still some of the doctors don't really take it on board, but more and more doctors are. And that is very encouraging. So I feel like we have we've broken through a bit, which is very exciting, really.
Yeah, absolutely.
Yeah.
So before we get into the kind of the nuts and bolts of it, can you explain what mast cells are and also what Mast Cell Activation Syndrome or MCAS is?
Yeah, so our mast cells are part of our immune system and they are everywhere. They're a bit like, I always liken them to the bouncers in a club. They are just inside the door, and they are there to stop things entering the body that could cause harm. But in Mast Cell Activation Syndrome, unfortunately, it's a genetic condition where these mast cells are hypervigilant and they are too reactive. So they react to chemicals and things that they should just really be ignoring. And they can't ignore them, and they create the cytokine storm and release all the the cytokines that they make and store, which can then have a very detrimental effect on the body, causing inflammation, etc., in various different systems. Now, the mast cells are under the skin. So some people it'll be manifested as hives and itches and rashes and psoriasis and eczema.
Again, we know can lead to probably more serious issues than the eczema itself long term. And then for people with things like psoriatic arthritis or fibromyalgia, it might be something like methotrexate, which as a form of what family does that come under? Chemotherapy, right? It's a form of chemotherapy. You think, well,
immunosuppressant.
yeah. So,
Yeah.
as you were saying, rather than look for the etiology of the problem, let's just give it a pharmaceutical, which we know almost all pharmaceuticals cause more side effects, which means more pharmaceuticals, but you're not getting to the root cause of the problem.
Yeah, absolutely. And, in America, the main most common cause of death is heart disease. The second most common cause of death is cancer. And the third most common cause of death is prescribed medication. And that is just horrendous. And instead of looking at the cause and trying to sort out the cause, it's often just, let's give something for symptomatic control, which of course, can be helpful if you've got pain and you want to control your symptoms. But you want to know what's causing it. And if you can sort out the cause of the problem, then that's going to be a much better solution, surely. It's, but poor MCAS patients, one of the things that breaks my heart is when I hear how so many patients have suffered for decades and they have been gaslit or ignored or told it's in their heads or sent to eating disorder clinics because they've lost weight, because they can't eat very many things, because they cause so much histamine in their bodies and so much of a reaction. And these poor patients, it's heartbreaking. I had a patient this morning who's 72 years old, and she cried when we were on the consultation because she said, I haven't talked about this to anybody for decades because nobody believes me. And I don't want to make a fuss. And, the whole thing, when she was growing up, she was treated by her family as if it was all in her head and she was just being awkward. And actually she felt terrible and she really felt ill. And there was no sympathy or help. And they actually made her very depressed, which it would do, wouldn't it? By the time she was 18, she was seeing a psychotherapist. And the trauma that caused her increased her immune response, So trauma and stress, childhood trauma and stress especially, can switch on your mast cells. So often in these patients, they start off with maybe infantile eczema. So you can see there's a tendency to overreact for their mast cells. And then they get multiple infections, which then trigger off their mast cells more. And then if they have childhood trauma of some description, that's going to make their mast cells even more vigilant because these mast cells are trying to protect the person and keep them safe. So, emotional trauma goes into that. And the more hypervigilant they become, the more symptomatic the poor patient becomes, and the more anxious. And of course, the stress of that can make it worse. So it can become a bit of a vicious circle. Often it can then be triggered again by Epstein-Barr virus, by glandular fever. And in my daughter's case, she had swine flu when she was 16 and went to college. She caught swine flu. So that really made her much worse. Her health became stepwise more and more, her health deteriorated in a stepwise fashion, depending on what she, after each infection. So she had swine flu at 16. She had chicken pox as an adult at 19, 20. And then she was so fed up of feeling so ill, that she decided to give herself superfoods in a smoothie every day, which was, of course, tomatoes, avocados, spinach, high histamine foods and fruits, which she was blitzing and eating. She decided she was going to do loads of exercise, which, of course, exercise causes MCAS as well, can increase MCAS. And that's when she poisoned herself over a few weeks so that she then had over 30 symptoms. And became so ill, I had to rush over to her flat and bring her home and then nurse her for 4 weeks to make her better. And that was the beginning of the story, really, for us. But, it's such a common story. People who think they're doing something to make themselves healthier, if they have this condition, are actually making themselves worse. Yeah. It's very confusing if you don't really understand what's going on. It's very frightening.
Yeah. So you said 17% of the population have MCAS.
Yeah. Yes.
So I'm guessing it's more than 17% of females and less than 17% of men.
Yeah.
Do you know what
it
the
would be.
differences are?
Well, if it's 80% female, so you'd expect 20% of the cases to be male and 80%. So it's 80% of 17% is female.
Yeah.
I'll let you work that one out.
Yeah.
Yeah.
Yeah. So it's, yeah.
Yeah.
Yeah. It's
Yes.
probably in the low 20s for females and probably in the low teens for men, I'm guessing.
Yeah. Yeah. So it is common. And it was my MCAS knowledge and background that enabled me to realize how to treat acute COVID in the spring of 2020, because one of the the mast cells make and store over 1,000 different chemicals. We don't even know what some of these cytokines do, but the ones we do know about are things like histamine and heparin and elastase 2 and so on. And they are very potent in very small doses. So they don't have to be produced in a very big dose, high dose, to have a big effect on the body. And that makes it quite difficult to detect them because also they are very transient. They can be released by the mast cells and then they're metabolized away and they're gone. So you could be too late looking for them in a blood test or something, you see. So, but there were these reports. Do you remember the reports were coming, these pathology reports were coming out of Italy in the spring of 2020. And they said, oh, it's very strange. In the lung tissue that we were looking at in these postmortems, we were seeing a breakdown of membranes. We were seeing bleeding, we were seeing clotting, and we were seeing hyperinflammation. And when I read that, I was like, well, that's MCAS that's killed that patient, because elastase 2 breaks down membranes, heparin causes bleeding, other cytokines cause clotting, and hyperinflammation is caused by histamine. So I thought, well, based on that basis, we should be able to treat acute COVID, therefore, with the same treatment as for MCAS. And maybe the people who are having real difficulty with the COVID are the ones who have MCAS. So most people who had COVID, they weren't very well. It was like flu and they got better, right? And then there were a few who went into hyperinflammation. There was a lot of reports about this hyperinflammation. And that is mast cell activation. So therefore, I started, when people were contacting me and saying, I've got MCAS, what do you think? I've got COVID, what do you think I should take? I would say, well, I think you should take vitamin C, high doses, because that's a natural antihistamine, high dose of vitamin D, magnesium, selenium, and zinc, quercetin, which is a mast cell stabilizer that you can buy over the counter, and antihistamines. Please take loratadine, 10 milligrams 4 times a day, and stop taking so much tea, coffee, the high histamine foods and drinks. Stop those whilst you're ill. And lo and behold, and this was in the Wuhan, initial, the sort of worst variant, people started to get better literally within 24 to 48 hours. And I was just so thrilled by this. And I was thinking, that's really good, gratifying. And then in September of that year, on the 10th of September, Dr. Lawrence Afrin, Weinstock and Molderings, they produced a paper in the International Journal of Infectious Diseases, and people can look this up, called the possible role of the mast cells, something like this, in hyperinflammation and the role of hyperinflammation in acute COVID, something like that. And in that, it was very exciting to see that because they'd come to the same conclusion that I had, but they are much more eloquent than I am at referencing something and writing an article about it. And it was brilliantly written and it's worth a read. And it went through all of how MCAS is associated with viruses and the virus caused the hyperinflammation by stimulating the MCAS, etc., and how to treat it. So, and it turns out that Dr. Shankara Chetty in South Africa, who has now become a very dear friend, he came to the same conclusion that I did. And he started treating patients in the same way. And he's a GP. So whilst I've treated about 50 or 60 patients with acute COVID over the last 2 years, he has treated 14,000 patients, and he's had nobody die, nobody go to hospital, nobody needed oxygen. And all of my patients just got better within 24, 48 hours.
Yeah, I remember in the spring of 2020, I ordered for my parents vitamin D, vitamin C, zinc, and quercetin. There was some other stuff as well that I remember. I can't remember what it was now. It might have been angiographis, I think it was.
Right.
But I don't think they ever got COVID anyway. So, but it was there. It was there in case they needed it.
Yeah, it's fantastic. Everyone should have those in the cupboard. Everyone. You can buy those over the counter. We should all have them ready because there will be new variants. And therefore, whenever you feel like you've got something, you should just take these.
I would imagine they were probably pretty good for, influenza as well, I would have thought.
Well, I think they seem to have potency in a lot of infections, so it's worth a go. You're not going to lose anything, and they certainly won't do any harm.
Yeah. So, as you were speaking, a bit earlier, I was kind of thinking, I'm guessing there is a relationship between MCAS and autoimmunity.
Yes, there is, and a lot of patients with MCAS have hypothyroidism and other autoimmune conditions. And what's very interesting is if you can manage the MCAS and control it, the autoimmune conditions often really improve too. So, and that is something we're seeing a lot more of now post-vaccination, is a lot of autoimmune diseases, which is no great surprise really when you understand the pathophysiology of the spike protein. But I mean, it was in the August of 2020 that I started hearing about long COVID. And in fact, a BBC reporter contacted me and said, she said, I heard you on a podcast talking about MCAS. And she said, I think I might have it. And she said, I've been on these Facebook groups talking about long COVID and a lot of the symptoms are very similar. I said, well, you see, I don't do Facebook. And I said, I'd heard some of the symptoms, but I wasn't really up to speed with a lot of it. And she said, I said, can you send me a list of all the symptoms that you're hearing from about people? And she did. And I said, well, I absolutely agree with you. I think it is MCAS. And then I thought, well, therefore we should know how to treat long COVID, and I went on she got me onto BBC Look East news, and I got 3 minutes, I think, to say something. And on it, I said, if any patients have got long COVID and they wouldn't mind downloading a free app called People With, there's an app, and it's free, and you can put your profile of all your symptoms, and then with a special code, so it meant I knew, the company knew they were patients with long COVID, and we could see what their profiles were like, and lo and behold, it was exactly like the MCAS profile. So 2,200 people downloaded the app, having seen the news, which was really exciting. And so we had a lot of data very quickly. And then that gave me the impetus and the confidence to open a long COVID clinic. And I did it for two reasons, really. One was I felt morally obliged because all of the news and the talk was nobody was treating it. Everyone was desperate. These poor people were languishing on their sofas, terrified that they were going to be like that for the rest of their lives, not able to work, not able to look after their children and stuff. And I thought, I have to try. And so I did feel morally obliged. But secondly, I was also very curious because I wanted to know, had these patients been undiagnosed, untreated MCAS patients who then got a virus, which just really exaggerated their MCAS, or had the virus caused the MCAS, in which case it should be quite temporary, because once you get it under control, then they should make a full recovery. And the only way I was going to find out was to have a clinic. So on the 1st of November, I opened a clinic. It was fully booked by the end to the end of March, within 36 hours. And I hadn't actually told anybody I was going to open it, so I don't quite know how that happened. But anyway, Facebook probably. And one of the good things that Facebook has done. and then so then I started seeing patients, and lo and behold, I would say 99.5% of all the patients I see with long COVID have got previously undiagnosed and untreated MCAS. And there have only been 2 patients that I can remember who didn't have any history at all, but that the COVID had caused it. And they responded to treatment incredibly quickly and got better incredibly quickly. Many of the other patients, it's taken a little longer. Some, although responding to some of the treatment, they see improvements very quickly. And some of them, bless them, have said, do you know what? I've not only got over the long COVID, but I am healthier and fitter and feel better than I did before the COVID because they were untreated MCAS.
Yeah. Julie, a 47-year-old who works in computer sales, came to see me complaining of lifelong irritable bowel syndrome, which included severe abdominal pain and bloating, loose and very frequent stools, along with hot flushes, menstrual brain fog, and low energy, which affected her work performance. After taking a comprehensive history, plus running some labs, I discovered that Julie had a parasite infection, which may have been causing the loose stools, a methane-producing bacterial overgrowth that was almost certainly causing the abdominal bloating and pain, a leaky gut, low levels of digestive enzymes, as well as eating too many high oxalate foods on her vegetarian diet. So Julie reduced the high oxalate foods from her diet, plus she took a broad-spectrum antimicrobial supplement to help with the parasites and the bacteria in her gut, probiotics to increase her good bacteria and help repair her gut lining. She also took prebiotics to help feed the commensal bacteria, digestive enzymes to improve her digestion, and herbs to help clear the toxic lipopolysaccharides from her system produced by the overgrowth of gram-negative bacteria. At the end of the program, Julie reported that her health had never been better. In her own words, the improvement is staggering. The abdominal pain and bloating was gone. Her stools were back to normal. Her energy was up. She no longer had brain fog or hot flashes, and her immune system had improved as she no longer suffered from frequent bugs and colds. If you're suffering like Julie was and you want to get to the root cause of your problem, you can arrange a consultation with me at bodycheck.co.uk. That's BODYCHEK. And if we're a good fit, I could help you achieve the same kind of results as Julie. Now, back to the podcast. If we can rewind a little bit, can you explain to the audience what histamine is and what it actually does in the body?
Yeah. So histamine is made in and stored in granules in the mast cells, and it causes permeability of blood vessels. So when it's released, it will cause vasodilatation with increased blood flow to an area. So if you think about what happens when you're bitten by a mosquito, it usually swells, it goes red, and it gets itchy. And that's all caused by histamine. So it swells because it causes permeability of the vessels, the little capillaries. So fluid passes out into the tissues to create the swelling. It causes redness, and it does that by the vasodilatation, and it causes itchiness because that's what the histamine also does to the cells. So that's sort of an easy way of remembering it, really. You don't need very much histamine to be released to cause those symptoms.
Yeah.
It also does some other things in the body. It's responsible for your circadian rhythm. It contributes to that. So that's why if somebody has high histamine, they can have insomnia. and real difficulty sleeping. And if they've had a lot of histamine to eat that day, high histamine foods, Coca-Cola, coffee, chocolates, then they might find it really difficult to fall asleep. And it's not just the caffeine, it's because their histamine is high. Also, we have an increase in histamine as a natural sort of part of our rhythm at about 3 a.m. So sometimes people wake at 4 o'clock in the morning because their histamine is high. It can also cause panic attacks because when your histamine is high, your body tries to reduce it by releasing adrenaline, and that can cause panic attack. So some of these patients, some people who are really confident, calm people who've never have taken everything in their stride, suddenly start experiencing anxiety and panic attacks, which seem to come from nowhere. And it's when the histamine is high. It's an indication that that's happening. And I think it's quite reassuring for them to hear that it's caused by something physical. It's a chemical that we will be able to get under control. And it releases acid in the stomach, which is helpful for protein digestion. So those, and it's a neurotransmitter. So sometimes when it's very high, people describe this vibrational sensation in their body. And I'm pretty sure that's to do with the histamine causing nerves to tingle, and fire. Yeah.
So with MCAS, that creates excessive histamine. Is that right?
Yeah. And quite commonly, most of my patients who have had their genetics tested, because that can be very, very helpful to do that. And I use a company called LifeCode GX. And we do their methylation cycle, their histamine metabolism. Yeah, they're very good, aren't they? Their reports are lovely, very easy to follow and helpful. And when we look at those, we often see that they've got histamine intolerance too. Now, histamine intolerance is when you don't produce enough histamine metabolic enzymes. So the enzymes that metabolize histamine away are diamine oxidase and one called HNMT. And if you don't make enough of those, then you've got a perfect storm, haven't you? You've got your mast cells making too much histamine and your poor enzymes not being able to cope with the demand. You can have the symptoms even if you have normal DAO levels. If your histamine is so high, it just uses up all your DAO too quickly. But generally, these poor patients don't make enough anyway, so they're poor producers. So when we checked Jessie's diamine oxidase level when she was super ill, it came back as less than 2. And that meant it was actually undetectable. So as soon as she was making any, it was gone. Her histamine was so high. And when 6 months later, when we had managed to get everything much more under control, it was 23.5. And the labs report that as normal, but it's not normal. Normal is 30 to 200. So I would just put that out there for people to know that if their diamine oxidase level comes back less than 30, it's not normal. It's going to vary depending on your histamine load. And she, some of the symptoms she had were totally histamine driven. So she was bloated like a balloon, and that was from all the fluid passing through her tissues and causing hyperinflammation. She was red because of the vasodilatation. She had low blood pressure because of that, so she had terrible POTS. She felt really dizzy most of the time. She couldn't, especially if she stood up or sat up. Or stood for any, length of time, even just 5 minutes standing was too much. She had nausea, and that's sometimes patients will wake up in the middle of the night, which was Jessie was doing this. She was waking up with sudden nausea and having to rush to the bathroom, but feeling really dizzy because her blood pressure was low. And then, being sick in the middle of the night just because of histamine, not because of, food poisoning or, a virus or anything, just because her histamine was high. And it would literally wake her up in the middle of the night. Her eczema was so bad that she couldn't turn her head. If she moved her head, her skin split. And she had terrible eczema in her antecubital fossa, and it was just awful. The photos are terrible. She had dermatographism. So her face was red from the vasodilatation. You could write your name on her forehead and it would stay there for 20 minutes. She had a migraine headache for 4 weeks, day and night. She couldn't sleep for a second for 7 days and 7 nights. Her insomnia was so bad from the high histamine. It was so high. And this, her IBS was terrible. Complete constipation, total blockage, nothing worked. She had pains and aches in all her joints, her knees, especially going up the stairs. Her muscles were aching, so she had fibromyalgia. It was just horrendous, absolutely horrendous. And and she had anxiety and panic attacks. So she had a full house, bless her, and that was all from drinking smoothies of superfoods. Now you see them being sold in Victoria Station, and people are. I think it's become more obvious now because people are saturated in high histamine foods and drinks. How often do we go to catch the train to go into London and people are standing on the platform with a Costa coffee or a Starbucks or whatever it is, and they've got this, and they've also got in their homes these Nespresso machines, and they're having really strong coffee before they even leave the house, so they're topping up their histamine all the time. So and then we're having more processed foods, which are high in histamine, and it's everywhere, isn't it? You can have processed food outlets everywhere. Yeah. And not only is that creating this obesity pandemic that we've got, epidemic of obesity, but it's also causing, mast cell activation in so many people. Yeah.
So it sounds like your daughter had the full Monty of symptoms of histamine intolerance.
She did.
I mean, is there any she didn't have?
No, I don't think so, actually. I don't think there were. But what was also fascinating was we gave her some antihistamines, and over a 2-week period, she lost 1/2 stone in weight, and it was all fluid. So we could see her shrinking in front of our eyes, and she was going to the loo every 15 minutes and passing water. And yet she was drinking her normal 2 to 3 litres a day, but she was passing water like there was no tomorrow. And it was clear, literally like water. And she was like, I can't believe it, Mum. I'm just going to the toilet every 15 minutes I'm having to go. And it was this fluid coming out of her tissues. And so we could see her getting better. We knew she was improving. The dermatographism settled down. Dermatographism is always MCAS. And burning mouth syndrome, she had that. And burning mouth syndrome is always MCAS. So if anyone experiences those, they know they've definitely got it.
Yeah. Just changing tacks just a little bit. You spoke a little bit earlier about people came to you with long COVID, even acute COVID. But can you talk a little bit about in your own practice whether you've seen clients having effects from the COVID jabs?
Yes, very much so. So initially it was long COVID patients, and it was pre the rollout of the injections. And then I started seeing people who had long COVID for follow-ups, and they would say, I was really doing well, I was getting so much better, and then I was called for my injection, my first dose or whatever, and then I took an absolute downturn, and became much worse. So I started to hear this story of sort of the detrimental effects of the doses, and also they were catching COVID, and the same thing would happen. I know they would say I was doing really well, and then I caught COVID again, and then I deteriorated, and then people started actually booking in who were fine pre their doses, and it was the doses that had caused the MCAS type symptoms. So it wasn't COVID, the infection. It was the synthetic spike protein that had caused the issues, and then I started hearing about some of their family and relatives and friends and what was happening to them. Yeah,
I mean,
not good.
Can I ask you to share your views prior to 2020 on vaccines in general?
Yeah, I mean, I never had the flu jab because I didn't feel I needed it. I believe in natural immunity and being as natural as possible. However, when my children were little, I did give them the vaccinations because I believed they were safe, and by believing they were safe and they were the right thing to do, I believed that they had been through very, very rigorous safety checks. And I trusted that they had been. And when I was at medical school, we were taught to trust the MHRA and that we were told that they were very meticulous and they were very, very difficult to get. It was difficult to get anything through the MHRA. And I believed that. And I had no reason to doubt it. But now, I don't believe it at all. So, their funding is 85% comes from the pharmaceutical industry. Yes. So they're completely captured, and that's totally unhealthy, isn't it? And if you look at, this is in the public domain. If anyone wants to see it, the MHRA public assessment report for the temporary authorization of the BioNTech vaccination, it's out there in the public domain. And if you look at pages 16 to 21, I think your listeners would be very interested to do that and see what it says. What were the safety checks? What safety data do we have? And actually, disappointingly, extremely little or none at all. So they did no carcinogenicity studies. They did no gene toxicity studies. They did no pharmacokinetic studies to see where it went in the body. They did no biodistribution studies to show where it went in the body, and no pharmacokinetic studies to show if the body could clear it, when the body could clear it, how long it would take, etc. And they did no fertility studies. They did no toxicity studies to make sure it was safe to have more than one dose. Yeah, so the whole thing was a real eye-opener to read that document. And of course, there are European periodic, they're called periodic reports, safety reports, I think, European periodic safety reports. Every 3 months, Pfizer have to produce a document for the EU, and they always make interesting reading too. First of all, they're often written in riddles, so they're really difficult to follow and to understand. Secondly, if you do plough through them, you can be really quite alarmed by some of the findings and some of the reports, and then even more alarmed when they say there are no safety signals here. When there's obviously safety signals. Yeah.
And of course, they were never tested on transmission either, were they?
No. In fact, Boehler, the CEO of Pfizer, admitted that they were never proven to prevent transmission or. So we were told they were safe and effective, and actually it would appear they're neither.
Well, it's interesting that they even called it a vaccine, isn't it, really? Because what the vaccines do, they stop transmission of viruses. Yes. Supposedly they do.
Yes, and actually that was one of the things that really struck me. There were a whole load of things that just didn't make sense from the very beginning. You don't isolate well people, you isolate and quarantine sick people. So the government policies didn't make sense. And calling it lockdown was weird too, because that's a prison term. A medical term is quarantine. and you protect the vulnerable. You don't tell young, fit, healthy people to stay at home to ruin the economy. One of the universities, I think Liverpool University, worked out 500,000 people died as a result of lockdowns. And just the whole thing, they ruined children's education, the young people's experience of university, all totally, totally unnecessary. Telling people to wear masks that don't work. There are over 100 studies that prove they don't work. The holes in the masks are 600 microns. The virus is 1 micron. So, do the maths. If you have somebody who vapes, take in a breath and then put a mask on and breathe out, it comes out everywhere. Yeah. If you hold your glasses in front of your mask, it will steam up your glasses, which shows that everything is coming through. And we know that the bacteria and the mold and everything that builds up on those masks within 20 minutes can be very, very detrimental to your health. In fact, it's healthier not to wear a mask than it is to wear a mask. And it brings down your carbon dioxide levels, your oxygen levels, and it builds up your carbon dioxide. And, that's not good for your brain. It's not good for your body. If the masks work, why did we have to stand 6 feet apart? The whole thing is just, there's no such thing as asymptomatic spread. If you have a disease, you have symptoms. I've never known of a disease that is asymptomatic. And then telling people to stay, if they tested PCR positive home for 14 days, what was that about? A PCR test is not COVID specific. It goes positive even for any virus, even for a cold and for flu. So it's not COVID specific. And it was set at very high cycles, 35, I think it was, cycles, which means that it was over 90%, probably 97% false positives.
I think it was 45 cycles in the UK.
Was it? Yes, that's right. So that gave you 97% false positives. Yeah. So therefore, when they claimed 100,000 cases, it was probably less than 3,000 because some of them would be colds and flu. The whole thing was just total nonsense. And I really hope that if they try to pull that on us again, that people realize and don't comply, don't wear the mask. People can exempt themselves from wearing the masks and just smile sweetly and say, no, I don't wear one. And people can't ask you why. They can be fined £10,000 if they ask you why. Yeah. And they have to pay you the money. So I would say to people, come on, ask me, because I'd like £10,000, please. But the whole thing is just bizarre. It's not scientific, that's for sure.
The other trick they pulled was when they quoted the effectiveness of the vaccine. They quoted the relative risk reduction, not the absolute risk reduction. So when they said 95%, it was actually, depending on the brand, it was between 0.8 and 1.5% effective, which is not effective at all, really.
No. And the infection fatality rates were less than 1% for the vast majority of the population. Yeah. And, so why did they need even to be vaccinated? Nobody needed to be. Maybe, you could justify giving a proper traditional vaccine to the very elderly, but not this messenger RNA gene therapy, which is, even the head of which, Bayer, he was in a company conference, and he said, it's amazing. He said, who would have thought that people would have accepted gene therapy and an injection? But since they've taken this vaccine rollout, we can now start looking into using gene therapy, messenger RNA technology in our medications. And he called it a gene therapy. And in fact, I think in Moderna, in America, there's some legislation around the messenger RNA, and in the documents they call it a gene therapy. It's not called a vaccine; it's called a gene therapy specifically.
Yeah. Talking of Moderna, I thought it was quite ironic. On Sunday, after Djokovic won the US Open, he won Moderna shot of the day, which I thought was quite ironic.
I didn't see that. I think he's brilliant. He is superb.
He's a
You know,
legend.
he stood by his guns. And when you think what the Australian authorities did to him, they stuck him in a horrible detention centre, giving him disgusting food, I'm sure. And he's got to be very careful about what he eats. He wouldn't have been allowed to train and keep physically active during that time. And I mean, what a load of nonsense. Complete infringement on his freedom and his sovereign rights to freedom and of movement and, you know, everything else. I mean, absolutely disgraceful.
And one of the healthiest men on the planet as well, who
Yeah.
already had COVID by that stage.
Yes, I mean, the whole thing is just, surely people will realise the illogicality of the whole thing. I mean, it's criminal.
Yeah,
It really
it
is.
definitely was criminal.
Mm.
Now, I always like to leave my listeners to have some actions that they can use to take away. And we've spoken about quite a lot of conditions. So we've spoken about, you know, fibromyalgia and things like eczema and dermatitis, psoriasis. We've spoken about IBS. We've spoken about long COVID. But I'm guessing a lot of the solutions are going to be similar. Would I be right in saying
Absolutely. Absolutely. So the basic principles of the treatment are you avoid the triggers. So you reduce the triggers and the stimulation of the mast cells. So that means having a low histamine diet, I'm afraid. And the best thing to look at is watchthebleepcanieat.com and pulling out a list of no and low histamine foods, which comes to about 200 foods. So you can manage a perfectly balanced and tasty diet from these 200 foods. I do it all the time. And then once you get your histamine down, your symptoms are going to really improve. And you want to take type 1 antihistamines and type 2 antihistamines, maybe a mast cell stabilizer like quercetin you can buy over the counter. You want to take good vitamins and minerals. So vitamin D, vitamin C, magnesium, selenium, zinc. And various others. Now, something very good to take. There's a wonderful, wonderful stuff for those who, don't want to be taking 100 different tablets, called Life Minerals, and it's got over 70 different vitamins and minerals in it, and it comes from fossilized. I'm not quite sure what, but anyway. It's full of enriched. It's wonderful. It's a liquid, so it's really well absorbed, and then it's about avoiding the triggers, so chemicals, avoiding Wi-Fi if you can, 5G, very difficult, and having a clean diet, having organic food as much as possible if you can afford it, no processed, no leftovers, and then. Looking after yourself mentally, meditation, things like the Gupta program, the Fern program by Susie Volt, and various things like that, so that you're looking after the mental side of things, because that your subconscious mind and conscious mind also can influence your mast cells. So you want to tap in as much as possible to that power. What else? Oh, I nearly forgot. An ARC device. This is amazing. This little device is, I'll show you it. It's my secret weapon. It's incredible. I wear it around my ankle. I just took it off. You wear it for at least 3 hours a day in a 24-hour period, so people can do it at night or during the day. I've done it twice already today, so I've had 6 hours on it. And it boosts ATP production, which is amazing. So in a single cell, there are 100,000 mitochondria, and they make and store ATP. We actually need to make and use 70 to 80 kilograms of ATP every day, which is much more than I weigh.
Wow. So
70 to 80 kilograms of ATP a day is necessary. ATP production is interfered with when something makes the mitochondria dysfunctional. And what makes mitochondria dysfunctional? Viruses do, the spike protein from the injections does, Wi-Fi does, 5G does, stress does, etc. So we are constantly underproducing ATP. But this device gives you a microcurrent, which you cannot feel, for 3 hours, and it boosts your ATP production 3 to 5-fold, which is amazing. And therefore, it helps the body to be healthier, whatever it needs to do. It helps reestablish homeostasis. And if you're in homeostasis, then you can reduce inflammation, you can reduce pain. If the inflammation is causing pain, then the pain will reduce. It's just incredible, this machine.
Wow.
Amazing. I know of couples who had come to the end of their IVF treatment who became pregnant within 3 months of both using the machine. A chap who had a massive coronary heart attack from his major ascending coronary artery being blocked, should have had lots of cardiac damage, should have had an infarction, as in a dead piece of muscle. At his 6-week checkup, his heart was perfect, as if he hadn't had a heart attack. I know my own father, his heart failure improved massively over a 4-month period, so much so that he could then have a hip replacement. And he recovered from his hip replacement like he hadn't. Honestly, it was amazing. Absolutely. And he was 90 at the time.
Wow.
And just incredible. So this ARC machine has helped so many of my patients, and reducing inflammation, aches and pains in their joints, and helping their IBS, everything. So really, really would recommend it. I feel like every household should have one. Absolutely incredible. Yes, superb.
When you were saying, increases ATP, I mean, I'm a very active person. I go to the gym. I play tennis competitively. The first thing I'm thinking is that could potentially improve performance.
Well, there's a very good article on exactly that. So a lot of athletes, professional athletes, they use these for rugby players, footballers, to help their post-training recovery. Because it really, really does. And absolutely superb. I would recommend it to everybody.
Sharon, a 52-year-old business consultant, came to see me because she was waking up every night and not able to get back to sleep, leaving her exhausted during the day, which was very concerning for Sharon. She occasionally had a dull ache in her stomach, and she also suffered from acne. But Sharon was most desperate to get to the bottom of her sleep issue. Following a series of tests, it was found that Sharon had a gut infection, which was the likely cause of her waking at night and causing the stomach ache, and she also had a leaky gut and food sensitivities, which may have played a role in her acne. Sharon went on a low FODMAP diet and supplementation plan to rebalance her gut microbiome and help repair her gut lining and to support her immune system. Within days, Sharon felt much better. Within weeks, Sharon was sleeping through the night, her stomach ache vanished, her skin was clear, her energy levels increased, and her weight, particularly around her middle, in her own words, simply dropped off. If you're suffering with sleep, gut, or skin issues and want to get to the root cause, and you'd like to achieve a great result just like Sharon, then go to www.bodycheck.co.uk, that's BODYCHEK.co.uk, to request your consultation. Now, back to the podcast.
And and I have so many patients. I had an email from a patient late last night saying, who was a vaccine damaged patient, really severely vaccine damaged. The poor woman, she had 1 dose and she has lost all her elastin in all her tissues. So she's suddenly become hypermobile overnight. She can pull her skin out like this, like wings. She's got no collagen anywhere suddenly, which is giving her terrible aches and pains and things. And in her email, she said, I can't thank you enough. The ARC machine is really helping me, together with something called augmented NAC. Now, we're all interested in getting rid of the spike protein and helping our bodies clear it because it's not a natural protein. Our bodies don't actually have a mechanism to clear it. And if they had done some pharmacokinetic studies, they would have seen that that was the case. So we have to denature the spike protein before our livers can clear it and we pee it out. And an Italian group called the Zero Spike Group have developed something called augmented NAC. So they found that ordinary NAC did denature maybe 2%, 10% erratically of the spike protein, and then the liver could start clearing it. But if they did some quantum physics on it, and they made sure that every single subatomic particle of that NAC had that potential and was working optimally, 99.8% of the spike protein that's extracellular can be denatured.
Wow.
Which is incredible. So people can take 1-3 times a day for 3 months, and they've shown that clears out the backlog of what we've produced over the last 2 years. And then one a day thereafter, because we don't know how long the messenger RNA will stay in our cells producing this stuff. And we think in some cases it changes the DNA. There is that, until we know how to mend that, we need to clear it out as it's made. Yeah. And certainly the immunosuppression that the spike protein causes is greatly improved by people going on this, because we know the pathophysiology of the spike protein, which I'm very happy to run over quickly. It causes the T lymphocytes to merge together and become useless and to become zombie cells. So that's something called syncytia. So instead of being separate, they become like a blancmange, and like that, they can't work. Now, T lymphocytes are a super important part of our immune system that detects and destroys abnormal cells. So if a cell has got a virus in it or bacteria in it, or has got precancerous properties, the T lymphocytes will destroy it. But if they are useless, then they can't work. You are immunosuppressed. So people are succumbing to much more in the way of infections. So when I was a GP, we used to see one case. I used to see one case of shingles a year. And it would be an elderly immunosuppressed person. And some of my friends who are working in general practice are seeing 2 or 3 cases a day in young people now. So that's because they're immunosuppressed. So it causes immunosuppression. It can form little filaments in the blood, the neutrophil elastase in the blood, and the amyloid beta of the spike protein can form filaments, and these are abnormal, and we've never seen the likes of them before. And also it can cause blood clotting. So we're seeing more people with heart attacks, strokes, pulmonary emboli, even young people. I have a 34-year-old friend who suddenly had a massive heart attack whilst he was on holiday and has had to have triple bypass surgery because it had formed clots in 3 of his main coronary arteries. He's 34, previously fit and healthy. I have another friend in his 50s who runs every day and is very slim, very, very particular about his food and everything. And he had a massive heart attack out of the blue. Absolutely terrible. And it's caused by this. We believe it's caused by this. It also causes inflammation of the lining of the arteries and myocarditis and pericarditis. Now, this inflammation is caused because the spike protein has a real affinity for the mast cells that line the lining of the arteries and causes inflammation. So it can cause aneurysms because the inflammation just rips it apart. So we've got aneurysms. A friend of my son's, a 32-year-old friend of my son's, she suddenly had an aneurysm and then a stroke from the clot that had formed over the aneurysm. Fit, healthy girl, age 32. So if it causes these clots in the eyes, we've got a lot of patients with blindness. I've got 3 patients one who went blind in 2 eyes and 2 who've gone blind in 1 eye. Sort of a year after having the vaccine, but no other cause can be found for these conditions, And the lady who went blind in both eyes, it was 2 days after the first dose. So it does all of that. Now, Basel, a recent study from Basel, they looked at 777 people. They checked them they had no comorbidities. They were fit and healthy. They checked them for myocarditis before they had any doses. They had, I think, 2 doses, and then they checked them again, and 1 in 35 people had myocarditis, some of which was subclinical. So they had no idea they had it. And if you have myocarditis, you're not supposed to exercise. You're supposed to wait until it settles and get better. And that could be why we're seeing sudden death in a lot of athletes, because they don't realize they've got it and they're exercising and then, their hearts stop. they're anticipating 50% of those people with myocarditis to die in the next 5 years. So that's 1 in 70 people who've been vaccinated could die in the next 5 years from that. I mean, this is a tragedy. This is awful. And then it upregulates 17 cancer-causing genes, and it downregulates 3 cancer-protective genes. So the P53, the BRCA1 and the PRB gene, the P53 gene is like the super chief quality control gene. And when a cell replicates, the P53 checks it quickly to make sure everything is in order. And if it is, it passes it. And if it isn't, it presses the destroy button. And that's how it stops us getting cancer. But if that's been switched off by the spike protein, then we're going to see an increase in cancers, which we certainly are. We're seeing a massive, in America, 10% increase in cancers, apparently, and in this country, and in the we're seeing more recurrences as well. So 10% doesn't even include the people coming out of remission. And Professor Dalgleish in London, he's an oncologist who's come out and said he tells all his patients in remission, please do not have you don't want this spike protein in your body, because I'm seeing so many of my patients who've been fine for 20 years suddenly getting recurrences. So that's really bad. And then the lipid nanoparticle, which was the envelope around the messenger RNA in some of the vaccines, not in all of them, that can pass through the blood-brain barrier. And we're seeing an increase in dementia, MS, ALS, CJD, and Parkinson's, even in some young people. So we have to get the spike protein out of our bodies, and using the augmented NAC is really, really helpful.
Yes. Sorry, just to clarify, you're talking about N-acetylcysteine when you say NAC.
Yeah, N-acetylcysteine, but you need the augmented one.
Right.
You need the Italian augmented one, because if you have the ordinary one, it will do it a little bit, but not enough. And patients respond so well to it. They come back and they say, do you know what? Even after 2 days, I felt more alert. I've got more energy, et cetera, et cetera. So, I know somebody who had aching joints, terrible aching joints, like, rheumatoid arthritis type pains, and dizzy spells, sudden tinnitus and dizzy spells, which would come out of nowhere. Very alarming if you're driving, and she's been using the augmented NAC, and now she's hardly ever having a dizzy spell, and all the joints pains settled down very quickly.
Yeah. I mean, I know I've listened quite a lot to Peter McCullough talk about getting rid of the spike proteins. He talks about nattokinase, bromelain, curcumin. Yeah,
curcumin, I would agree with that, but I would add the augmented NAC and intermittent fasting, which increases autophagy, because there are 50 mechanisms, apparently, that can cause autophagy in the body, and that's destruction of abnormal sick cells. And 50 out of the 50 processes, 25 are switched off by the spike protein. So another reason why we're seeing more cancers and feeling more ill and more tired, et cetera, et cetera. So the anything you can do to increase autophagy is a good idea. And intermittent fasting does that. Resveratrol does that. I also recommend, if you can do cold showers, cold water swimming, that's really good to increase autophagy. And also the gut is some of the bacteria in the gut are destroyed by the spike protein from both the virus and the synthetic, particularly Bifidobacterium and Lactobacillus, which are very protective bacteria in the gut, as you know, and they produce short chain fatty acids that protect the lining, and they are protective. And if they are diminished or destroyed, then your lining is more vulnerable, and you're more likely to get a carcinoma of the bowel, cancer. And so important to replenish those bacteria, that's Lactobacillus and Bifidobacterium, with probiotics and prebiotics. But also I would take sodium butyrate, which is a short chain fatty acid that will protect. So you get instant protection. And that's 300 milligrams a day. And the other thing that's really good to take is melatonin. Melatonin slow release 2 to 10 milligrams at night, because melatonin has got a lot of very anti-cancer properties. So yeah, all of this stuff is,
Sorry, how much melatonin did you suggest?
I start with slow release 2 milligrams, and if people need more, they can go up to 10 milligrams. Yeah. That needs a prescription in this country. Yeah. But in other countries, you can buy it over the counter or the internet.
Yeah. So there's quite a lot that people can do. That's, it's
absolutely.
It's not a dead end road. It's
no, we're not going to let this defeat us. We're not going to let this defeat us. And we need to look after each other. We need to tell our family and friends about this. They may not believe you every time, but please do. If you do it with love in your hearts, they will realize that you're coming from a good place. And if you look at zerospike.org/EN, that's the Zero Spike Project website. There's loads of information and interviews and data, medical data on there, papers and things, articles that you can say to people, look, just have a look for yourself and do some research. They can look at financetechnologies.com to look at the government statistics that actuaries have put together that show a story about the excess deaths since the rollout of the program. And there's loads of places they can do some research for themselves and then make up their mind. But people need to be informed. They really do.
Yeah. You can't make an informed choice if you're not informed.
Exactly. And it turns out, now that the formulation that they got the MHRA pass for isn't the formulation that they used.
Yeah.
So therefore, nobody gave informed consent.
Yeah.
Because nobody gave informed consent properly anyway, because we weren't told about all the, problems, side effects, potential problems. People weren't told that actually more people died in the vaccine group than in the placebo group in the study. No one was told that. No one was told about Guillain-Barré, and a friend of ours, he got Guillain-Barré within 3 hours of his third dose and was on a ventilator, totally unable to move even his eyes for a year, and is now having to learn how to walk again. And this was a fit 52-year-old guy who used to go to the gym every day. Nobody gave him properly informed consent, but we actually also thought we were getting that formula, and we were given another formula that was substituted without anyone being told. And the whole thing is just crazy.
No one was also told that there were other alternative treatments.
No.
That were very cheap, very effective, but obviously if they had been allowed to have been used, they wouldn't have got their emergency authorized
use authorization. Yeah, exactly. And I did actually inform various people about the treatment that I found, because I was really excited about it. I thought, this is the answer, this is great. And so I actually did communicate with various people in authority, and nobody got back to me. And I also communicated when I worked out how to treat acute long COVID with the chief executive of the head of the Royal College of GPs, because they produced a very useless, really, document, unhelpful document, let's say. They produced a very unhelpful document which said, long COVID is real. Listen to your patients. And the treatment is 86 pages long, I think, or 63 pages long, something like that. That's right. It's 83 pages long. And on page 63, I think it says how to treat it. And it says treatment. Listen to your patients, ask them to rest and to make a list of their symptoms. That's the treatment. So I contacted the chief executive, the head of the Royal College of GPs, and I said, actually, I've been treating long COVID with really good results, and I'd love to share that with you for your document. And they didn't even get back to me. And I contacted the head of the NHS, the person who was in charge of the NHS long COVID clinics. And she told me to do a randomized controlled trial and then come back to her with the evidence. Now, randomized controlled trials take millions of pounds, and they take many years to do, and to publish. It can take you years to publish anything. And I said to her, we haven't got time to wait for this. We need to be treating these patients now. I spent an hour on a Zoom call with her, and she didn't want to know. And I said, just let me talk to some of the doctors who are going to run these clinics, and I can share my experience with them. Won't that be helpful? She didn't want to know. Very disappointing.
Yeah, there was only one agenda, wasn't there, right from the beginning, really?
Would seem so. I mean, that's what all these indicators are. Yeah. That's the only conclusion we can come to, isn't it?
Yeah.
And I believe they've just come out with a statement about childhood inoculations, which is worth having a look at.
Yeah, I'm sure.
Yeah.
I know they're very keen in America to vaccinate the over 6 month olds again with the new version.
Oh, it's terrible. They have no safety data, no medium and long-term safety data. They have no idea what will happen to those children when they're 5 or 10 or 15, whether they'll be infertile, whether they'll get cancer, they have no idea. Why on earth would you give it to a 6-month-old baby or child?
That was my message 3 years ago.
Yeah.
Right. There was no medium or long-term safety data.
No.
Even if you believed what the original studies kind of showed, although they wanted to hide it for 75 years, didn't they? Why would you want to hide that for 75 years?
Well, if you've got nothing to hide.
Absolutely. I mean, my whole message, this time 3 years ago was, first of all, the disease itself doesn't seem that bad. It's not as bad as it's being made out. There seems to be natural treatments that are very cheap and effective with very little side effects, if any.
Exactly.
There are no safety studies. There are no safety studies. Certainly long term, there weren't any. And these are being produced by companies that have been fined billions of dollars for fraud, bribery of doctors,
lying. Yes,
lying, but also manipulating studies as well.
Yeah.
Why would you trust those people? Why would you trust them?
You're absolutely right. And Lee, that's exactly what I said on the Lawrence Fox show on GB News at the end of February. That's exactly what I said. I said, when you're going to start, when you look at the need for any vaccinations at all, you have to think, first of all, how bad is the disease? Which age groups does it affect? What's the infection fatality rate? The infection fatality rate for this is less than 1% for most people. So therefore it doesn't justify having any vaccinations at all. Secondly, is there any treatment for acute COVID? Yes, there is. Is the treatment safe and effective? Yes, it is. So you just do that. And then absolutely, as you say, why on earth would you use something that has no safety data or has a lot of data that shows it's not safe? Within 2 months of launching it, Pfizer were aware and had been notified of over 1,200 deaths caused by the vaccine within 2 months. Yeah. That's not normal. That's not healthy. That's not fine. It's not okay. It's not okay. Never mind the fact that, as you say, there was no medium or long-term safety data, and you're going to give it to the whole population. This is a recipe for disaster. Yeah. But, they knew what they were doing.
Yeah. Yeah. I definitely think they did. But I guess to end up, for anyone that's suffering from any of the conditions we've spoken about today, any of them, I think the message is there's hope. And,
absolutely.
And there's something that can be done. And I'll put in the show notes as much information as I can to try and help people, and maybe even share some of the websites that you've shared today. I've kind of scribbled them down as you've been speaking, and I'll pop those in the show notes, and hopefully, as many people listen to this, even if they haven't got those issues themselves, maybe pass it on to people that have. At the end of the day, both of us we're in this for the same reason. We're here to help people.
Absolutely, and look after each other, help each other, keep happy. Don't let this get to you. enjoy your lives and let's preserve as much freedom and body autonomy as possible.
Absolutely. Yeah, absolutely. Tina, I've really, really, really enjoyed this discussion with you today. I'm sure we could talk for hours and hours. I would love you to come back and talk about menopause actually at another later date.
Yeah, happy to.
A great thing to do.
Happy to.
What's next for you?
What's next for me? I'd like to train more doctors and help more doctors to do what I do. I need more help in my clinic because we've got so many patients to help. And for me, I want to help people to clear the spike protein and to recover and restore their health, which we can do. Yeah. And we will do. And, we will do it. There are some incredible scientists working on this, and they are very close to getting something that will get it out of our brains as well, clear it away. So, just keep working with really good people and trying to spread the truth.
Awesome. And where can people find you online?
My clinic is www.menopauseconsultancy.co.uk. And actually, you can book online for menopause consultations with my colleagues, my associate doctors, but also for long COVID, etc., MCAS, with my other associate doctors on there. And but we can only see people who are resident in the UK because of our medical insurance, sadly. But there's quite a lot of information on my website. And so a lot of people find that it's a good place to start. And I've also opening a YouTube channel, which is going to have a lot of the interviews and things so people can, And I actually, one of our patients who is amazing has just made an incredible 30-minute video, which I'm going to put on my YouTube channel. And he describes MCAS so much better than I can. Mm-hmm. He's just amazing. And he talks through his journey, and it's just so helpful. And I think it will help thousands and thousands of people around the world to see that. So it's going to be on my YouTube channel.
Do you know what your YouTube channel will be called?
It's just Dr. Tina Peers, I think.
Okay, great.
Yeah.
So people might listen to this in months' time when it's it's all set up. So that would be great.
Yeah.
Tina, thank you again so much for your time today, and I'm really hoping that this is going to help some people.
Yeah, I'm sure it will. Thank you.
Awesome. So that's all from Tina and me for this week. But don't forget, you can join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.